Welcome to the deep dive. So, you've handed us a stack of material today about something that sounds, well, visually quite alarming: canine vaginal prolapse and hyperplasia.
Yeah, it definitely can look concerning.
Right. And our mission here is really to cut through the density of these expert sources, the vet info, and just pull out the clearest, most essential takeaways for you.
Exactly. We want to help you understand what the research actually says.
And just a quick note before we jump in. We're exploring the information in these sources for understanding. This isn't about diagnosing your own dog or anything like that.
Absolutely crucial point. This is about unpacking the knowledge provided.
Okay, so the topic. A protrusion of tissue from a female dog's vulva sounds worrying, and it can be, but understanding the nuances that these sources highlight is really key.
It is. And while people often group hyperplasia and prolapse together, the material you've shared really emphasizes some important distinctions, but also some shared aspects between them.
Let's do it then. So the core issue, the most obvious thing someone would see, is this massive tissue coming out, usually when their dog is in heat, right? That seems to be the main picture.
That's the classic presentation, yes.
Yeah.
During Proestrus or Estrus, when estrogen levels are high, that's the main trigger.
Okay.
But interestingly, the sources do point out some rare instances. It can apparently happen during pregnancy or even during the birth itself. Parturition.
Wow. During birth?
Yeah, or even sometimes if a dog has been given certain estrogenic drugs. Less common, but possible according to this material.
Okay, so timing is usually linked to the heat cycle, but not always. Now,
Yeah.
these two terms, hyperplasia and prolapse, are they just different ways of saying the same thing? The sources seem pretty clear they're not.
No, definitely not. And this is probably one of the most critical takeaways of the material you shared. They look similar, that tissue sticking out, but what is actually protruding is different.
So break that down for us. What's the difference?
Okay, so hyperplasia, or sometimes they call it edema because of the swelling,
Mm-hmm.
it's described as a more localized swelling. It's just the mucosa, the inner lining of the vagina, that's protruding.
Just the lining.
Right, often on the floor of the vagina, just in front of the urethral opening. And the key thing here is it's seen as an exaggerated response to estrogen.
An overreaction, basically.
Kind of, yeah. And one source mentions something fascinating from the histopathology, looking at the tissue itself. Despite being called hyperplasia, which implies cell growth,
Uh-huh.
what they actually see during the cycle is mostly edema. So it's swelling from fluid buildup, not necessarily true tissue growth or hypertrophy at that point.
Interesting. So it looks bigger, but it's mostly swollen lining. What about prolapse then?
Prolapse is different. That's when the entire wall of the vagina protrudes, full thickness.
The whole structure.
Yes. And this suggests maybe something more is going on, perhaps some underlying weakness or laxity in the tissues, or maybe increased pressure inside the abdomen pushing it out. It's still linked to the hormones, but there might be these additional factors involved.
Wow, okay. Lining versus whole wall. That's a significant difference.
Yeah.
So how would a vet tell them apart just by looking? You mentioned the sources talk about different shapes like donuts or tongues.
Exactly. The appearance offers clues and, crucially, where the urethral opening is located relative to the mass. That's a big one.
Okay.
So with hyperplasia, especially the less severe types, type I and II, it might look like a tongue or a fan shape or maybe a partial donut. It's usually pink or red, looks shiny and swollen.
Yeah.
Edematous.
Mm-hmm.
But here's the key differentiator that sources point out. The urethral opening, where the pee comes out, is not on this mass. With
Yeah.
these types, the vaginal opening is sort of above the mass,
Mm-hmm.
dorsal, and the urethra is below it, ventral.
Okay, so the pee hole isn't part of the swelling itself in hyperplasia.
Generally, no, not in those types. But with prolapse, especially type 3, which is the full circumference, that's often described as a larger, maybe darker red or even purplish donut,
Signs are dramatic.
it can look it. And here's the visual contrast. With this type of prolapse, the urethral opening is often visible right on the ventral aspect, the underside of the prolapse tissue itself.
Ah, so where the urethra is located on the mass or separate from it is a major clue to tell hyperplasia from prolapse. That's a really practical detail from the sources.
Absolutely. It's a key diagnostic sign.
Now, who gets this? You mentioned young dogs. Are certain breeds more prone?
Yes, the sources give a pretty clear picture of the signalment. It's overwhelmingly seen in young, intact female dogs, most commonly around, say, 18 to 22 months old.
So their first few heat cycles often.
Often, yeah. Though the range mentioned is quite broad, from like 6 months up to almost 5 years old.
Yeah.
Breed predisposition is definitely a thing.
Which breeds did the sources mention?
Primarily large breeds and also brachycephalic, those short-nosed breeds. They list boxers, mastiffs, English bulldogs, St. Bernards, also Labrador and Chesapeake Bay retrievers, German shepherds, Springer spaniels, Walker hounds, Airedales, and pit bull terriers.
That's quite a list. Does this point towards genetics being involved?
It strongly suggests it. Both sources really emphasize a hereditary component. They mention it running in family lines.
That's significant, especially for breeders.
Absolutely. It raises questions about breeding practices, which is a point the material brings up. So besides genetics and breed, the main driver is that estrogen stimulation.
Right.
But other potential factors listed are things that increase abdominal pressure, like straining if the dog is constipated or has trouble urinating. That's especially linked to full prolapse. And also dystocia, a difficult birth. That's a risk factor too.
Okay, so genetics, hormones, sometimes pressure or birth difficulties. Got it. What about other signs? Besides just seeing the mass, what might you notice as an owner?
Well, besides the timing usually being with the heat cycle, though, remembering those rarer exceptions we talked about.
Like during whelping. Yes.
Right, which one source said could be like 8–12% of cases, surprisingly high. You'd likely notice the dog licking the area a lot. That's irritating.
Makes sense.
If it's happening when she's fertile, she might refuse to mate. And if the mass gets really big, it can physically press on things.
Like the urethra or...
Exactly. It could cause dysuria, it's difficulty or pain when urinating.
Yeah.
Or potentially even constipation if it's pressing on the rectum. And something else the sources highlight is recurrence. If a dog has had it once...
It's likely to happen again?
Very likely, yeah. High recurrence rates are mentioned if the underlying hormonal cause isn't addressed.
Okay, so given it's often quite visible, how does a vet actually diagnose it? Is it just looking, or are there lots of tests involved?
According to the sources, it's primarily a clinical diagnosis. So the vet relies heavily on the history you provide.
When it started, previous cycles, stuff like that?
Exactly. And then a thorough physical and vaginal examination. They'll look closely at the mass, its size, shape, texture. Is the tissue healthy or damaged? And critically, they'll identify the location of that urethral opening and the vaginal lumen relative to the mass.
To tell hyperplasia from prolapse.
Precisely. That exam is usually enough for typical cases. The sources do mention ruling out other things like vaginal polyps or even tumors, especially maybe in older dogs or if it looks unusual.
Would they biopsy it then?
They might, particularly in atypical cases, but it's not routine for the classic presentation of hyperplasia or prolapse in a young dog during heat. And interestingly, things like blood tests, urine tests, x-rays. One source explicitly listed those as NA for typical cases.
Meaning not usually needed.
Right. It suggests it's generally seen as a local issue, not something affecting the whole system initially, unless complications develop. They also mentioned checking for clitoral hypertrophy as something else to rule out.
Okay, so mostly based on history and a good look and feel. What are the dangers if it's not managed? What could go wrong?
The main worry, if that tissue is left exposed, is damage. The sources list several potential complications. Trauma just from the dog licking or rubbing it.
Yeah, that makes sense.
The tissue can dry out, which is painful. You can get ulcerated, infected, and in really bad cases, you can get necrosis.
Tissue death.
Yes, tissue death. That's serious. And the other major risk, especially with that type 3 full circle prolapse, is obstruction.
Blocking things.
Blocking the urethra. If the dog can't urinate, that's an emergency. A large mass could also potentially block bowel movements, causing constipation. And, if it gets severely infected or necrotic and isn't treated, it could lead to systemic illness, severe pain, and could even become life-threatening.
Okay, those are definitely serious potential outcomes. So what do the sources say about treatment? How is this managed?
They outline a few main approaches,
Yeah.
and it kind of depends on how severe it is, whether the tissue is damaged, and importantly, the owner's plans for the dog, like for breeding. So first, there's conservative management. This is often the starting point if the tissue looks okay, and maybe you want to preserve breeding potential for that cycle. The absolute priority here is keeping that exposed tissue clean and lubricated.
How?
Using sterile, water-soluble lubricant. And just as critical is preventing self-trauma. So an Elizabethan collar, the cone of shame, is pretty much essential.
To start the licking.
Exactly.
Yeah.
And really vital, especially if it's a large mass or that type 3 prolapse. You have to monitor urination closely to make sure the dog can still pee.
Makes sense. What about medications?
Medical management is mentioned mostly for hyperplasia, and if breeding isn't the immediate goal, certain hormone injections like GnRH or HCG can sometimes be used. They work by basically pushing the dog to ovulate faster, which then changes the hormone balance and helps the swelling go down maybe a couple of days sooner. But big caveats here. This only works if given before ovulation happens. And the sources strongly warn against using progestogen drugs because of the high risk of causing pyometra, a nasty uterine infection. And this hormonal approach just won't work if the dog's progesterone is already high.
So limited use for the hormones. What about surgery?
Surgical considerations come in for the more severe, persistent, or complicated cases. One option is manual reduction, basically, gently pushing the tissue back in. This might need sedation or even anesthesia.
Okay.
For prolapse, after reducing it, the sources mention potentially using a temporary purse string suture around the vulva. It's tied loosely enough to allow urination, but helps hold the tissue in while the swelling resolves.
Like a temporary drawstring.
Sort of, yeah. Then there's surgical resection or amputation. That's removing the protruding tissue altogether. This is reserved for cases that are really severe, can't be pushed back in, or if the tissue is dead or dying, necrotic.
That sounds more involved.
It is. It might sometimes be done standing with sedation, but often needs careful surgical reconstruction. And the sources mention specific scenarios too, like if it happens during pregnancy, both resection or reduction combined with a hysteropexy.
What's that?
That's where they suture the uterus to the body wall to help support it. Both have apparently been used successfully. And if it happens during a difficult birth, a C-section might be needed, although vaginal delivery is sometimes possible with really close monitoring.
Okay, so quite a few options depending on the situation. But is there one thing the sources point to as the sort of definitive fix?
Yes. Unequivocally, both sources highlight ovariohysterectomy, or spaying, as the most effective long-term solution and the best way to prevent it from happening again.
Why is that so effective?
Simple logic, really. Spaying removes the ovaries. The ovaries are the source of the estrogen that's driving this whole exaggerated response in the first place.
No ovaries, no estrogen surge, no prolapse or hyperplasia.
Exactly. You remove the primary hormonal trigger. The sources state it prevents recurrence and might even help the current episode resolve quicker.
Can they do the Spay surgery while the dog is in heat with everything swollen?
They can, yes.
Yeah.
Though the sources do note that the increased blood supply during estrus can make the surgery potentially a bit more challenging for the vet. But given how likely it is to come back.
That high recurrence rate you mentioned.
Right. Spaying is strongly recommended, especially for pets where future breeding isn't a concern.
Which brings us right back to recurrence. You said it's high if a dog isn't spayed. How high are we talking?
The numbers in the sources are pretty stark. They state a 66% to 100% chance of it happening again at the very next heat cycle if the dog isn't spayed.
Wow, almost guaranteed in some cases.
It seems so. And even if they do surgical repair, like resection, without spaying, one source still quotes a 25% recurrence rate at the next cycle.
So spaying really seems key for prevention. What about the overall outlook, the prognosis?
Generally, the prognosis is good, especially if it's treated effectively, and particularly with spaying. For medical management of hyperplasia, it's also good, unless there's that urethral obstruction we talked about.
That's the emergency.
That changes things. And of course, untreated severe cases, especially with necrosis, have a much poorer prognosis. But overall, with appropriate intervention, most dogs do well. The sources really circle back to recommending OHE staying because of that genetic link and the extremely high likelihood of it coming back otherwise.
This has been really clarifying, actually, taking something that looks quite frightening initially and breaking it down. So if we pull the main threads together from these sources for you, the key is realizing hyperplasia and prolapse aren't the same. Hyperplasia is that swollen lining and exaggerated estrogen response. Prolapse is the whole wall coming out, maybe with other factors involved too.
And checking the location of the urethra, that's a huge visual clue for the vets.
Right. And understanding it's mainly driven by estrogen, often affects young, large breed dogs, and has that strong genetic component helps explain the why and who.
Absolutely. And I think what really stands out from the material is that while you can manage the immediate situation conservatively or sometimes medically, especially with hyperplasia, that incredibly high recurrence rate combined with the known genetic factor points very strongly towards spaying as the definitive preventative measure. That feels like a core message from these sources.
I agree. That seems like the bottom line for long-term prevention. And thinking about that strong genetic component and how likely it is to happen again even after some treatments, here's something the material implicitly raises for you to think about.
Okay.
What responsibility does that place on owners, and particularly breeders, when this condition appears within a family line of dogs? It sort of pushes the consideration beyond just treating the individual dog in front of you.
That's a really important point to ponder.
definitely something to consider. Thanks for joining us for this deep dive.